was this a normal case for you? I'm trying to help the viewers kind of understand. Like,
Yours was pretty straightforward, yeah.
pretty straightforward, nothing too complicated.
No bumps, no.
No bumps, nothing like that. Okay, so I had you placed 5, 1 remaining. One of those was a pterygoid implant. For our patients out there that don't know what zygomatic and pterygoid are and which part of the bone that is, help explain that.
Pterygoid is the very back part of the jaw, upper.
Okay.
Right, when we need to extend the prosthesis as much as we can backward with a good back support without too much cantilevering, because usually we place the implant in front of the sinus only, in as much as we can, and then we cantilever the last molar or so.
Yeah.
If we have enough bone or good bone behind the sinus where we go to the pterygoid, actually, will be very good and nice for the stability and strength of the prosthesis, and also help the front implants without to have more support.
So you're
Makes sense.
distributing the weight more.
More and be able to go more backward as I want.
Okay. So deeper in the bedrock.
Yes. Yeah, kind of.
I mean,
The zygomatic ones, this is when all options are gone. No bone, no front bone, no backbone, nothing. This way we go. Actually, we are placing the implant in the skull, on the face, not in the jaw at this point.
wow.
The zygoma is this bone here.
Okay.
Okay.
So right here,
Right here,
that goes back.
Like, yes.
So you'd have to angulate it
Yes.
back in these.
But this is the last resort. Last resort when everything else just like didn't work.
So is that typically your person who's been in a denture for 30 years?
Kind of. Sometimes even with those, we can start, I prefer personally, maybe do good sinus lifts, build some bone, and deal with the jawbone versus dealing with the skull bone. Again, I'm not saying that this is, but in some cases it just has to.
Yeah. You know, one of, is that what you did? You didn't do zygomatic with mom. You were still,
pterygoids.
You just did pterygoids, right?
Yeah.
2 pterygoids?
2 pterygoids and I believe 4 on the front too.
Yeah.
So yeah.
Yeah. You know, I've told our viewing audience of just, you know, because I had to go through this with mom and live that life, and you got to hear that story and really help her. I've given you a lot of credit for that, and thank you for helping my mom with where she was to where she is now. But, you know, you're talking about zygomatic, you're talking about some of these complicated things, and I always want to remind patients out there that you know, we did multiple consultations. We've gone and seen, and mom was a challenging case.
Your family in general. No. I mean, she has been wearing denture for how many years?
20 something years.
That was one of the reasons that finding the good amount of bone was not that easy. Yeah. So it was very crucial of how to find bone. The planning was a little bit not straightforward now. It's gonna,
which was unique because we went to one of the more famous ones that does a lot of marketing, has multiple clinics around the nation, and sat with that doctor and he said, no problem, get you done, you'll have your finals the next day. What would have happened if she had done that? Honestly, I mean, you know the case, you saw the bone, you saw what could he have done in that period of time to even, and remember how long it took for the healing?
Yeah.
So what would have happened if you had your final restoration in 72 hours?
High risk of failure. Very high risk of failure.
Okay.
I don't want to comment more.
I understand. I understand. You can't throw anybody else under the bus, but as a patient, it just kills me that there's not more standardization out there on how to do it right. Don't cut corners. Okay. So now I'll get off my soapbox. You placed the 6 implants. Did the case go like you had thought it was going to go? Was there any surprises during it? There was.
But it got solved during the surgery.
I know it got solved. I'm here on it. I'm asking you.
Yeah.
There were some surprises. Okay.
One of the areas that I was counting on to place an implant, when I get there, actually it was so mushy and it's just, the bone.
Really?
One of the implants that where the infected implant was.
Yeah.
Infected the tooth, not this side.
Where you had to clean out the...
Yeah, I didn't expect to have all this kind of bad bone.
I mean, that's a pretty aggressive abscess, right?
Yes, and actually, in a very short time.
Yeah, it was
Very
fast.
short time. From the time we took the CT scan to the surgery wasn't that long. It was almost 2 weeks. That I believe. It was much bigger than what we have the CT scan. So my plan based on the CT scan, I took the last, right?
Yeah.
But when I get there, it was already get much more.
Make sure your doctor knows how to handle an audible.
And this is one of the things that, if we want to go back to the navigation versus the static. So if this was planned static, I'm stuck. Because I'm planning to do this one, now the whole environment has changed. Okay, what I can do at this point?
Yeah.
I have to maneuver.
Yeah. And if you just had one hole that was pre-drilled for you to stick your drill in and place the implant, and then you're hosed. Because
Not only that, knowing where to place it alternatively. This is part of the designs, because I have the design, we designed the, I'm not sure if Dr. Retana talked about this one, we designed it prior.
he touched on it, but please share.
We designed the position of teeth and the bite before the surgery, and we try to place after that the implant based on the final prosthesis. We design backward, right?
Okay.
So if I'm having the implant have to be placed here to serve this particular area of the prosthesis, if I want to change it, if I don't know exactly where I should go to follow the rest of the foundation, I will be in big trouble.
So how much in that audible where you had to change it a little bit, did Dr. Retana, when he had the denture to convert it, did he have to drill out some extra areas?
No. That's because like we designed together and we know exactly where we need to go.
Okay.
So I know exactly where the design before the, I also know the design before the surgery. And I planned it accordingly as well, right? So even if I want to change something, any angulation, I need to change it within the scope of this.